Our final session of day one. Do you know, I say day one, and you know what I mean. But actually, and you know this, we've had working groups, we've had board meetings, and actually for the team, they have had months of planning. So why don't we put our hands together for everyone who's put this incredible 2, 3, 4, 5 year-long gathering together. It's epic. And actually being back in this room and being here in Mexico City, it is like a United Nations of eye health. And I've absolutely loved meeting guests from around the world today. And I'd love your reflections on what I know has been a very busy day indeed. So let me welcome back up to the stage somebody who has been presiding over the day so far. Caroline Casey, everybody. Caroline, day one. How's it been? Oh, where's your mic? Come on, here we go. Come on, right, here we go. God, standards, right. Let's just double check. Sorry, Caroline, stitch you up there.
Thank you very much.
There you go.
How's day one been? Yeah, it's been absolutely fantastic. I have loved it. I think everybody who was around yesterday and today and said, the energy here is just incredible. And when you think how far we've come since Dubai, because we were even just talking about it, it's amazing. And can I just say the staging and the exhibition and all the stands, it's been a really great day, as well as all the speakers.
And the exhibition for me has been brilliant because you get to meet the people behind the badges as well. So you really get the whole layout. So I urge you to keep exploring that tomorrow. Really unfair to ask for a highlight, but I'm going to ask for one anyway, Caroline. Highlight of the day so far?
I think the highlight for me is just what's going to come. Because what we're just going to do now has been something that Anna McKeown has been leading within the IAPB, something really important about that next generation of leaders. I think that's my exciting part.
Right.
My highlight now.
And it's right to say that this next section really is about acknowledging and recognizing, spotlighting some outstanding individuals. It's our Young Systems Leader Award. Just help us set the scene a little bit about what this award is about, because you've been very involved in it.
Well, for people like me who are middle-aged and 52, we've been around a long time, and I think one of the things, a young generation, it's a very different world to the world that we may have grown up in or been working in. And we wanted to really highlight and put the light on leaders from all around the world who are going to be that next generation of leaders leading us to our target of ending avoidable sight loss. So it's been something we've really wanted to do, but this is our first pilot, and we are absolutely thrilled to have 9 young system leaders, which is amazing. But I do want to say, very sadly, 3 couldn't be with us today, but we do have 6 with us. 3 today, 3 as we close off today, and 3 tomorrow morning. But can I just please give a moment to the 3? I just want to take a moment to acknowledge them. I'm going to read it out because I'm really bad at pronouncing names. Juania Augusta. Juania is an ophthalmic nurse from the National Committee for the Prevention of Blindness in Haiti, and she would have absolutely loved to be in here. Balachu Paulos. Balachu is County Director for Vision Action in Ethiopia. And Fatima Zehra. Fatima is Program Manager for LRBT in Pakistan. And I want to say, I had the absolute honor of being with this incredible group on Zoom through lots of conversations. And it's so hard that the 3 are not here today. Could we just give them a round of applause, please? Because I really hope they're watching online. I'm so sad you're not here. And one of the things that was really important as we were talking, which is very important now, and relating to the conversation of this morning, it's not just what these young system leaders are doing, it's who they are. And that's just a really important part of how and why they were chosen.
Yes, it's a really important point, isn't it? These are personal awards as much as about their work in the world, their organizations, right? So you've hinted already, Caroline, we're going to recognize 3 tomorrow morning.
Yes.
And, drum roll please, 3 this afternoon. So tell us a bit more.
Okay, so can I just hear you shout and scream and get on your feet, because I want to invite our three young system leaders of 2024 onto the stage, Kayo, Rusman and Fatima. Please come and join us. Give them a big shout and a round of applause. Woo! Woo-hoo! Woo!
Amazing. Congratulations. That's incredible. Congratulations. Hey, Kaya, congratulations.
Now, I did hint that, thank you, yes, thank you for getting on your feet. This is my highlight, because it's seeing these individuals who have literally given their young, wild and precious life to this work. And what I wanted to do, rather than we just hand out certificates and, you know, do that, I actually wanted you to get to know each of them just a little bit. So, I am not going to read out bios, because there's nothing worse than somebody telling the story of somebody else. So I have asked each of them just to tell a little bit about who they are, why they care about the work, and where they're working from. So Kaya, would you like to begin and just tell us a little bit about who you are and why you love it and what you're doing?
Well, my name is Kyle. First, I want to say thank you for the opportunity to be here and for this award. It's really important to me. I'm from Brazil. I think I need to start with the story why I'm here, actually. I was born and raised in this scenario. My dad was an ophthalmologist and a really devout ophthalmologist. And he founded a philanthropic eye hospital in Brazil. And 5 years ago, he passed away because he took yellow fever. So it was something like really suddenly he passed away, and there is no one to take his place. So I stopped everything that I was doing at the moment, and I need to become president of this hospital, a really important hospital. Actually, the most relevant, not most relevant, but the main hospital to medium high complexities in São Paulo, in the capital city. So that was become my life in eye health. And I think one of the most important points of this story, like probably 1 or 2 months after I took this role, I was walking by the hospital and a woman stopped me, and she started crying a lot and hugged me, and I didn't understand why that's going on. And she told me, "You saved my life." And really, I didn't understand that at the moment. Sorry, it's really hard to say about that. But she told me that I saved her life because he did a vitrectomy surgery, and he just get out of the surgery, and he was almost blind, and now he was like 20, 40, something like that. So he received the life again, as he told me. And then in this moment, I understood why I was in this role and why this hospital was so important for so many people. And I think that's it. That's I think you...
See? Thank you, Kayo. Can we just close the doors at the back so we can just stop the noise filtering? Because it's really hard for people just to speak and tell that story. So, Rosamund, would you like to tell us about your story, who you are, what you do, and anything else you'd like to add?
Okay. Thank you, Caroline. So, hi everyone. I'm so grateful to be here today and have the support of ANZF and Fred Hollows Foundation. So my name's Rosamond. I'm the DRNet Regional South Pacific Coordinator. So I do work in the Pacific Islands. A bit about my journey, how I've gotten here today. I started off as a clinician working as an orthoptist, doing a nationwide eye health survey. And from that experience, when I was providing care to patients on a one-on-one level, I felt like I was really limited in what I could actually do. I wanted to be able to do more and reach more people. And so then I transitioned into doing translational research for Indigenous communities, and that really allowed me to reform the system to ensure that Indigenous people had access to eye care services at a primary care level, at a secondary care level, and a tertiary care level. And it was from that experience that really got me to focus on my work, working with Indigenous communities, because in Australia, although it is a developed country, there is so many disparities and inequities that Indigenous people face. Only 50% of Indigenous people have their eye screened for diabetes, compared to 72% of the rest of the population. And that is such a big gap, and that shouldn't be happening with all the services that we have. So that's really driven my purpose to want to be able to do more in that space, to reach more people, and for them to have the opportunities like everyone else in Australia has. So yeah, that's me.
Thank you. And Fatma, last but not least, come on, tell us a little bit about you.
Oh, okay. So I grew up in Baghdad. I grew up in Iraq, and some of my earlier memories ever was I remember when I would come back from school, I would rush and get ready and go on a bus and sit with my parents, and then hours later, we would find ourselves in another province. In that province, I thought we were there because I wanted to see my friends. So I would play and I would learn, and that was where I lost my first teeth. That's where I learned how to play football. But then I realized that we were there because there was no ophthalmologist in that province, even though it was millions of people. And we were there because for that half day, they would have an ophthalmologist who would look after them. And then years later, I still had those friends with me. I still had those earlier memories in my mind, even though we were no longer able to access them because of the conflict. I kept on wondering what would happen, or like what happened to my friends, what happened to their families. And I was also intrigued by the pathology. I was intrigued by the clinical aspect of those clinical conditions. So I pursued my medical degree. I earned also a master's in public health for eye care from the International Center for Eye Health. And I found myself motivated by serving those people and also putting their stories on the front line. So now I serve as the regional representative for the youth in the Middle East North Africa region. I represent 280 million youth in the region, and I also serve as the national point of contact for the Space Generation Advisory Council, which is an advisory council to the United Nations Office for Outer Space Affairs. And what's motivating me still so far and in every day is not just the pathology, not just the clinical aspect, but the people behind it. It's the people behind those conditions, it's those friends, it's the people that maybe we don't see on those board meetings or we don't see in those high-level committees, but they're the real motives. They're the ones who are driving this change, and they're the ones who are driving this world even. So it's an empowerment to us all once we have those stories out there.
Thank you. I mean, come on, aren't they great? Okay. Now, before you leave and get your rewards, I want to do 2 quick questions for you, all of you, so we can learn from your wisdom. So what has been your highlight today, each of you? Like, what's been the thing that has stood out in your mind, or even to getting you today? So, Kyle, what's for you?
For me, I think it's really the environment that all the EAPB created. All of those years, my second year coming to the Congress, and for me it's really good because there is no competition here. So it's clear that we can align forces, and that's exactly what I'm doing in Brazil. So last year I just aligned forces with 2 other NGOs, and we threefold our numbers. So we are going to, our goal is to reach 500,000 people in Brazil this year, and I know this is the kind of environment that we can make connections and try to do something like that. So for me, this is really interesting. I passed through some small from the rooms, and for me it was really amazing. So much people sharing knowledge and sharing what they are doing, and it's incredible. And I think it's the whole environment.
Thank you so much. You're absolutely right. Well, that means IAPB, we're doing our job right, okay? Because it's the most important thing, this idea of radical collaboration, that we will get together faster. So I thank you for that. Rosamund, what are you thinking?
So for me, it was actually the personal stories that were shared this morning. And so it kind of reminded me of my journey, how I've gotten here, but also it gave me a couple of reflections that I want to share with everyone here today. So I think the first point that I got from it was that no human is limited. So that quote was said by Eliud Kipchoge, so I don't know if there's any other runners here. I'm a runner. He's a marathon runner from Kenya, and he did the No Human Limited project, where he was going to break 2 hours for the marathon, and he was able to do that back in 2019. And the message behind that was that he didn't want anyone to be limited by their thoughts or what they were doing, wherever that be work or sport or whatever. And I just thought, I guess as a sector, we're working towards, ending avoidable blindness by 2030. And it made me reflect that we're going to have challenges, we're going to have setbacks, we're going to have people not agreeing with what we're doing as a sector, or they might not even recognise eye health as being a priority or important to them. But I think it's really important that we don't limit ourselves with the beliefs that we have or the limiting beliefs of others, and that we keep on pushing and working together as a sector to achieve the goal. Because in order for us to achieve the goal, we're going to have to come up with ideas or things that are outside of the box. We might have to be the first one to create a new service delivery model that hasn't been implemented before, or develop a policy that is new and different, but we need to be brave and be willing to able to do that. And then just one final point I wanted to share was that we all have a story, and so some of us might not have that lived experience, or we might not have immediate family who have been affected or had their vision affected, and we might not come from a country that has enormous challenges that they're trying to overcome in order to provide access, but we all have a story. So individually we have a story, as a sector we have a story, and I think as Megan mentioned this morning about the jigsaw puzzle, I mean there might be, I think, 500 of us here and some online, and we're each a part of that jigsaw puzzle. We all have that piece that we bring, and we're trying to create this beautiful picture where everyone can live to their fullest potential and we achieve the goal of ending avoidable blindness. So I just think we need to keep that in mind, that we're not limited and we all have a story, and that's going to help us to reach the goal.
Thank you. Thank you so much. Fatma, what about you? What's been your radical collaboration? We've all got a story and we fit in together. What about you?
So mine complements the two as well. It's in terms of interdisciplinarity and interconnectedness, because in every panel today, in all the discussions, you can see people from academia, from the private sector, from the public sector, clinicians, academics, working together and collaborating, each from their own sector, and also having a listening ear and collaborating and learning from each other. So I feel that with this collaboration, with this interconnectedness, that's the way forward, because it's not working in silos, it's not, it's the bridges that connect us rather than walls.
Thank you, very well said. Now, we're gonna do Ollie's 60-second quiz thing. You get to be the boss of the planet, okay, for a moment. And from your perspective, where you stand in the work that you do and have been around, what is the one thing that each of you would take, that you would do to accelerate the change we want to see? So I'm going to give that to you first, Rosman. So,
for me...
and you have to do it in 60 seconds,
yes,
because he's starting to move.
Okay. For me, what was mentioned already this morning was bringing the patient voice into the goal of ending avoidable blindness. So I really believe that we need to co-design with the patient being at the table. So when we're talking about coming up with tangible solutions, whatever that is, on the pathways that we want to map to determine what the gaps and barriers are, we can do that with service providers, but at the end of the day, we're trying to reach the people and the patients, so they need to be at the table and have their voice heard.
Mic drop. Brilliant. Fatma.
So from reflecting on all the sessions that we had today, and also reflecting on Rosamund's comment, and looking at the state of the world today, there's no doubt that technology will be an essential tool and an enabler for us to achieve access of healthcare to everyone, and also health for all. And looking at technology as a tool and as an enabler, again, we need to have patients' voices, and we need to have their stories there, and we need it to be led by the people. When we look at the data availability, there is lots of discrepancy in terms of high-income countries and lower-income countries, and there are lots of gaps, especially of undocumented data, lower-income settings, and rural areas that are even more impacted by vision impairment, and also women, minorities, indigenous people. So people need to be at the center, and it needs to be inclusive of everyone.
Excellent. Great mic drop. Okay, Karia, the last words to you.
If I was in your chair,
Okay.
I'm probably gonna put a lot of energy in Love Your Eyes program. I really like this idea, and I think we need to put more, literally more love in our lives, because it's a patrimony. It's something that we give. There is no money that we can buy. So if we can share knowledge and awareness to the population, probably don't have so much people that doesn't know how important it is to get access to eye health. And secondly, that's my goal now as a person working in this area. I'm trying to reach the people that are in remote areas and don't have access to ophthalmology or even optometrists, depend of the country. So I want to try to create an innovative way of assistance that we can reach these people that doesn't have access and doesn't have the opportunity to get access to eye health. So I think it's
That's perfect. Can I just ask the three of you to stand up here at the front of the stage? These are your first young system leaders of 2024, Kaio, Rosamond, and Fatma. Round of applause, please.
Thank you, Caroline. I mean, it is right to say that, you know, I've met a lot of talented people, right? And I think that we are so fortunate that you've chosen to focus your skills on this sector, and we're so grateful. We want to, by the way, I've seen the face of our future keynotes and leaders, and I'm inspired and a bit intimidated as well. So I think that's healthy. We want to recognize these achievements with a token of that recognition and an award, and also a certificate. And I'd love to ask Dr. Babar Qureshi to come up and help present those so we can mark this special moment. And of course, we'll be doing this for colleagues tomorrow morning too. Welcome back, Babar.
And we just want to thank Mary for coming up with these absolutely beautiful awards. I said, please be really creative. And I just want to say, Mary, I can't see you in the room, obviously, but wherever you are, will you please stand up?
Mary, yes.
Our Mary, who is one of our extraordinary mentors, and the amount of support and love and all of the thoughtfulness went into these gifts. I just want to say a huge thank you. So, thank you, Mary.
Yes. Well done. Now let's present them.
I think it's a great privilege to actually present these awards to all of you. And thank you, Caroline, for taking this huge leadership on the Young Systems Leadership Program. And I'm so pleased to see these three young people this evening here. And the first award goes to Kaya.
Thank you, everybody. Why don't we give our three young systems leaders a brilliant round of applause as they leave the stage, and we'll catch up with you later. Thank you. Congratulations. Thank you. Fabulous. Thank you. And thank you, Caroline. That was awesome. Thank you. Now, Babar, welcome. Yeah, maybe well, I didn't want to waste a trip up to the stage, but, you know, I always enjoy your reflections at this midpoint in our summit, Babar. So I don't know whether this will be off the cuff or something that you've had time to reflect on, but we are closing day one, so we welcome your thoughts. The stage is yours. Everybody, Dr. Babar Qureshi. Welcome, Babar.
Thank you. I think we've had incredible 2 days. Well, for some of us, a couple of more days, but the last 2 days have been brilliant. I mean, yesterday, the working groups where all the members engaged with each other was just extraordinary. And I think the energy that we've been hearing about came to its peak with the just three young systems leaders that we have just seen this evening. And I'm sure you'll be equally excited to see them tomorrow morning at 9 o'clock, I'm told that's a session, and I would urge that all of you are here. Ollie, you did not ask me the question, what was my highlight of the day? But I'll answer the question anyway. For me, the first session was really a transformative, powerful session on patient voices. Because I think that's what we are all about. That's the thing that we all do, and that's what we should all aim to do. Thank you.
For now, folks, that concludes our very first day. Thank you.